right, let's move on to the decision by CVS to stop selling any and all tobacco products. Is it going to make a big difference in how many people smoke or not?
It is the largest drug store chain in the country, so it'll certainly have a major effect, particularly in areas that are heavily populated areas where there are lots of CVS locations, so it certainly goes to that. I think what's interesting here is that the really the pivot for CVS towards trying to be seen as a healthcare provider at a time when people are going to be getting more insurance because of the Affordable Care Act. Primary care physicians in this country, there's a shortage of them, and there's a concern that because of this influx of new people who got insurance, that these primary care physicians will be overwhelmed by these new patients. By CVS, by moving into this direction to become more of a healthcare provider, they could sort of fill that gap. So you'll see these minute clinics that are already,
Yes.
already in existence.
Right.
They want to double those in the next few years. So more and more people will be getting that primary care through physician's assistants, nurse practitioners at these locations rather than their typical primary care doctor.
Molly.
Well, in the aftermath of the State of the Union, the big sort of buzzword for the White House was that Obama was going to effect change using the pen and the phone. And the White House immediately hailed this move from CVS. And I think while the pen aspect of Obama's proposal got a lot of attention, these executive orders, the phone aspect is these private sector partnerships where the administration is able to use persuasion or whatever to get private companies to help them achieve a lot of their goals. We had President Obama announcing also this week an education broadband initiative where tech companies pitched in, I believe, nearly $1 billion to help schools have technology. So these are the kinds of things that the administration hopes to be able to achieve on a voluntary basis in a situation where nothing gets through Congress.